afternoon. Welcome to the session. I hope everybody has been having a wonderful morning so far. I think the sessions have been fabulous. I am so excited to introduce my panelists. I think this workshop and this session is going to be really fantastic. So a topic very close to my heart. My name is Linda Murakami, and I am the Advocacy Relations Director for our Solid Tumor Oncology portfolio at Amgen. I'm happy to be here with you. I'm a fellow survivor, and I truly cannot wait to introduce my panelists. So I will definitely kick in here. I'm going to ask both of them to go a little deeper. I have my colleagues, Reverend Tammy Denise from Carrie's Touch, a Sacramento breast cancer organization. Tammy Denise is fabulous, and I can't wait for her to talk about the amazing work that Carrie's Touch does. I have also with me my dear friend, Dr. Keith Crawford, Doctor, I like to call him, double doctor, from the Prostate Health Education Network. So we have both coasts covered. We have Sacramento, we have Boston, and I'm in the middle of the country in Colorado. So I am going to hand it over, Reverend Tammy Denise, Carrie's Touch. Please introduce yourself and share a little bit about your amazing organization.
Wonderful. Thank you, Linda. Thank Doctor. I like that title. I'm going to go with that now. Folks in the chat, just call me Tammy. I'm just a regular girl from Indianapolis, Indiana, who moved to California about 30 years ago. I am a 16-year breast cancer survivor. And as a result of my journey with breast cancer, I wasn't finding what I needed available with regard to services and resources for Black women diagnosed with breast cancer, for resources that would show hope. Everything that I found, including my conversation with my doctor, said that I was going to be dead within 5 years. Well, here I am 16 years later, and I get this awesome opportunity and privilege to hang out with you, Linda, this morning, with Dr. the GRIT team, and everybody else out there. I'd like to start with sharing a slide just to show you how we're going to walk through this. This is really kind of the big overview, broad stroke of Carrie's Touch. We'd like to look at it as if it's a puzzle. You know, if you look at each section, it almost looks like puzzle pieces. And that's what your life feels like after you've been diagnosed with cancer. It feels like everything has shattered and you've got to put the pieces of your life back together. So that's how we'll engage with this graphic. We'll start up at the top. You know, when you put together a puzzle, you find all of the edges first, right? So we'll stop in the top left corner with the part that shows Carrie's Touch in the white. And we're African-American breast cancer survivors and other community advocates. And we are breaking the silence that adversely impacts African-American women and the community with regard to breast cancer. We are strong in our commitment to raise awareness that Black women can and do survive this disease. Unfortunately, quite often you don't see Black women in victory poses. When you see people running across the finish line and they're raising their arms and they're excited, Caucasian women will have a sign that says, I'm an X number survivor, but frequently Black women will have a sign that says, I am running in memory of, which subliminally tells us that Black women don't survive this disease. So I'm here today to tell you that though the disproportionately higher rates, we're moving down into this bottom left corner of the diagram, African-American women die at about 41% higher rates than Caucasian women who are actually diagnosed more frequently. And that's just not okay. There are some reasons why we can tell the community and the world that Black women can and do survive this disease by just showing up. just me being here today tells you out there that, hey, we can have some positive outcomes after Black women have been diagnosed with breast cancer. So here's my question. Are there any African-American breast cancer survivors out there listening today? If so, let us know in the chat. We'd love to connect with you and talk to you. We're moving over to the why. We're moving into the gray area. Why? Why are Black women dying from breast cancer so much more frequently than others? Well, part of the reason is there's a history of abuses in the medical community. We've got stories like Tuskegee, the abuse in the Tuskegee trial. We've got Henrietta Lacks. We've got even the Depo-Provera shot, where Black women were being sterilized without their knowledge. And these are recent studies, and that has an impact on the community. We also don't have trust with medical professionals because of these medical traumas. And what we want to do is we want to build healthy patient-physician relationships so that we can have more women who survive this disease. It's not all on the medical community. We have to take ownership for our part in why the disparity is so high with regard to mortality. We suffer from a syndrome called the Superwoman syndrome, and it's the strong Black woman. And if we look down at the bottom right, it's the Black woman. She's got her cape on, and she is taking care of everybody except herself. And then the strength actually becomes toxic. And we call that toxic strength. And what we want to do is we want to encourage people, women, to take care of themselves, to consider who they are, how they function, what are their needs, and be able to accept help and take off of that cape and turn it around and make it a blanket and put on some self-care. If we move on up the road, we've got that's why Carrie's Touch is advocating for Carrie's Touch Cares. We want compassion when we have communication, and we want to make sure that we are understanding what is being communicated when we go into our doctor's offices. We want acknowledgement that culture matters. When I walk into my doctor's office, I need my doctor to know that I'm a Black woman. I was 39 when I was diagnosed. So I was 39, I was a single mom, I had 3 children. I had a whole lot going on that he needed to understand what was happening with me in my personal life and what was happening with me culturally, with the messages saying that Black women die more frequently. So all of that matters. And then S is for support. Support, to know that Black women need support too. And guess what, Black women? Please accept it. Just say yes. When someone says, I'd like to come over and help you, say yes. When someone says, what can I do for you? Have a list already ready to let them know what that is. Okay, I'm going to move along so that I can hurry up here. Then what we're doing is we have a partnership with UCLA. We're up in the top purple section now, in the left corner of the top purple section. We have a partnership with UCLA called Project SOAR, Speaking Our African American Realities. That research project began 2 years ago with in-person gatherings where we got groups of women together to hear their stories about their experiences from their perspectives. Quite often, healthcare doesn't listen to the voice of the patient, and this puts the patient front and center and in the driver's seat as they are communicating their experiences. Project SOAR is in phase 2 right now, and phase 2 is an online survey. So if you put your name in the chat, I will put our website in the chat as well when I finish, and you can go online and take part of this groundbreaking historical research project with UCLA and Carrie's Touch, looking at you experiencing breast cancer from your perspective. We want to hear your story. And we are also considering ethnocentric, patient-centered care pathways, where we put the patient in the driver's seat from diagnosis all the way through re-entry after treatment. And that's a development that is coming out of Project SOAR. It's not fully developed yet, but that's our next step. So if we come over to the big circle, as we round up, we say we are creating a pathway that actually cares, improved quality of health, because your voices are heard and your needs are met through reimagined clinical trials and healthcare systems. So in a nutshell, that is Carrie's touch.
Tammy, thank you so much for sharing that. That is a beautiful, beautiful visual. And I feel like it really is a tapestry that takes people through all of the wonderful things that you have done, your experience, what you've learned, but truly and importantly, the title of this session is Through the Eyes of the Patient, right? It's looking at health disparities and it's tailoring to meet the patient where they are and to acknowledge the patient and who and everything they are. So I feel like just you being able to share that, definitely hop in the chat. There are lots of folks who are looking for information, who would like to share.
Wonderful.
Contact, to a patient friend, somebody they know, which is absolutely fantastic. The great pleasure I have in being at Amgen and getting to partner with groups like you, and certainly with PHEN, I feel like the work that you do is in the community. You are a person who sits in the community, who wants to help serve, your community, but the broader community, to both help understand the importance of tailoring, messaging, and information. But you're there for everybody. I mean, one of the things that resonated with me when hearing about the work that you do, you said, I have gentlemen who come in and look for information and research, whether it's for themselves, men get breast cancer, or whether it's for their loved one, right? Their mother, their sister, their daughter, et cetera. And so thank you so much for that. We're going to come back to you, so don't go anywhere but to the chat.
Okay, sounds good. Thank you.
Thank you. So Mr. Keith Crawford, that would be doctor as an MD, doctor as a PhD. Shout out to Prairie View A&M, your alma mater, and then Harvard, where you got your doctor. Please share with us about the Prostate Health Education Network, an amazing advocacy group focused on prostate cancer, created by our dear friend Tom Farrington, who is a 20-year plus survivor of prostate cancer, and realized the gap that there was in creating information for the African-American men and caregivers and wives who are touched by this disease. So if you, I'm going to hand the mic to you and let you jump on in.
Well, thank you, Linda. But first I wanted to kind of give out a shout out to Reverend Tammy Denise. 16 years. And I'm going to ask you, Tammy, did you participate in a clinical trial?
Yes, I did, Doctor.
Okay. That's what I'm talking about.
Yes.
So, and the second thing I want to do is I greatly appreciate Amgen and want to thank Amgen. And I want to thank Linda for just her continued effort at helping our message to display, to communicate our message to everyone. And then I also have a graphic pictorial that I like to share. And then I can go into some information about PHEN. So very similar to Tammy Denise, Reverend Tammy Denise. This is a pictorial of PHEN and PHEN's activities. But behind this, and the whole message that we're talking about is through the eyes of a survivor. So these are through the eyes of a 20-year survivor. And that's what I want people to recognize. Tom Farrington, the founder, the president, and the leader of PHEN, is a 20-year survivor who happened to celebrate his birthday yesterday. So to me, those are important milestones that people need to hear. So what I elected to do is I'm going to break down our path to kind of give you an idea about PHEN. And these are important points about PHEN. PHEN provides information and support, but it's important to recognize, and this is something that Reverend Tammy Denise mentioned, that the existence of a disparity in care. And our role is to help close that gap, close the disparity gap, but not just to close the disparity gap for African American men, but provide support for all men in this fight against prostate cancer. Now, that's what our mission is. And that's why our motto is knowledge is the best defense against prostate cancer. So everything that you've seen in that previous graphic is what we're going to talk about. PHEN is a continuum of education and support for the prostate cancer patient, their caregivers, and their loved ones. This continuum is screening, diagnosis, treatment, and clinical trials. And there's one thing that I wanted to say. We don't do this all by ourselves. And this tool, like many tools that we'll discuss, is to educate people. And why? Because people see things differently. Some people can read literature. Some people can learn by listening. Some people are more visual in how they take in information. And I also, and what I forgot, I wanted to give a big thanks out to the folks at Get the Picture, because what they were able to do is help me create this image to help drive this presentation forward. And as I said before, when we think of prostate cancer and you think about how PHEN approaches education and support, we identify screening, diagnosis, treatment, and clinical trials. And when we talk about through the eyes of survivor, these are the particular stages and pathways that the president of Prostate Health Education Network, PHEN, has traveled and continues to travel. A message, screening, just to drive the point home. Black men, you are all at high risk for prostate cancer. The general population, the incidence is 1 in 9. But when you look at Black men, 1 in 6 will develop prostate cancer. Now, if you have a family history of prostate cancer, 1 in 5. So, but now that you know where the problem is, what are you supposed to do? And the message here is early detection. And this is the same message, whether it's with breast cancer or with colon cancer or multiple myeloma. It's important from the standpoint of any cancer. And since we're talking about prostate cancer, early detection is important. And the reason why I say this, you don't have to search for the information. You can come to PHEN's website, and we're a reliable source of this information. What I'm telling you here is information that was published by the CDC, the Center for Disease Control, October 16th. And they said, this study showed that if you had cancer and it was isolated and you detected early, your 5-year survival was 100%. And your 10-year survival, 98%. That's 10 years. Now, what is this? And why is this important? African American men, you are at high risk, and you need to start screening, discussing prostate cancer screening and being screened at age 40. And all men, if you have a family history, you also need to start your discussion with your clinician about early screening. So you'll hear about the PSA test. Now, this is an FDA-approved prostate screening program. But we're also going to ask people to do this. As we move forward with these new cutting-edge technologies that we'll talk about later, it's important to understand your genetics, your genes, because you may have a family member or a mother or sister who has a BRCA gene and developed breast cancer. So that may put you at risk to develop a cancer. And if you're a Black man, your incidence of developing prostate cancer is high. The message here, early detection. The message here, talk to your doctor. The message here is talk to your doctor when you're 40. Next, and this is what I consider to be a landmark approach at helping the patient. So we launched this at the end of September, a soft launch, and we're slowly getting this tool, this educational tool, out to everyone. This tool will help Black men close the disparity gap, but it will help all men in this fight toward prostate cancer. This is a tool. Now, what you'll hear about this is this: shared decision-making. Now, I don't know if you heard about it. I don't know if you're hearing about it and you understand what that means. But what it means is that a doctor and you are going to sit down and have a shared discussion about what your treatment options are. Now, a lot of people will be uncomfortable sitting down with a clinician, a doctor, a healthcare professional, who 4 years of undergraduate training, almost 20 years of training in a healthcare field, versus you who may not have had any experience in this field. So the tool that we've created, this interactive platform, empowers you, because what it does do is brings you up to a level that you can have that bidirectional communication with your healthcare provider. Because if you can understand your risk, then you can understand what treatment options are available. And if you can understand what treatment options are available, then you can participate. You can be confident that when you participate, that you've made the right choice for your treatment, and not thinking years later, no, I regret making that choice. So this is why this tool, I consider, is a game changer for prostate cancer patients and caregivers, loved ones. It's for everyone to help them along this journey. Now, that's why I asked Reverend Tammy about clinical trials. As with breast cancer women, African American women, there is a disparity of involvement in clinical trials for Black women. And that is the case for African American men for prostate cancer. Now, we should, African American men, participate in clinical trials at a level representing 22% of the total population of participants in the clinical trial. We don't. There's some trials with prostate cancer where there are no Black people, Black men. Some 2%, some 4%. It's slowly increasing, but there is a lack of Black male involvement in clinical trials. Now, we can sit there and complain about it, or we can do something. And PHEN is a doer. So what we did was create this tool, this Find Your Trial, the FIGHT tool, to help you identify clinical trials. Now, if I go back, the Pathways tool talks about treatment options, but did you know that clinical trials are treatment options? So now, once you identify your risk level and you want treatment options that may be more advanced. Because let me tell you about clinical trials. What's important about them? One, you're going to get the cutting edge technology. That's the things that haven't yet been standard of care. And what I mean by standard of care is what any person, any clinician, when talking with their patient would suggest. Now you get these cutting edge technology. Also, because a clinical trial has so much oversight, and if you're concerned that you're not getting the appropriate care, you're going to get a tremendous amount of oversight, people interacting with you because they want you to be successful in their trial. And then the last thing is zero, no cost. But it's good. We know we've surveyed our groups and people that have attended some of our educational programs, webcasts. People want to participate. African-American men want to participate. But the problem is, there's a problem. Why is it? If you were to look at clinicaltrial.gov, you get lost. What we've done with the FIGHT tool is just organize it. Once you know your risk level, once you know your diagnosis, we've created 6 to 7 different categories that we personally curate, we personally review, and put them in that category. And it represents clinical trials that are ongoing in the United States from phase 2 to phase 4. And to me, that's important because it makes it easy. For you to identify what's important for you along in your treatment process. Why do you participate? As I said before, cutting edge technology. And when you hear this term placebo, no matter what in a cancer clinical trial, you're going to get the standard of care. You're not going to get a sugar pill and not get the standard of care. Clinical trials will, at a minimum, give you the standard of care, plus then this cutting edge technology. And this cutting edge technology is important because we don't participate, and we don't participate things like what happened before in this new class of therapies called immunotherapies, where a trial was successful, 2003 to 2010, successful, but it didn't have enough African-American men in it. So they had to wait an additional 7 years to figure out that African-American men should be on these type of therapies because they were even living longer. Now, we're looking at this cutting edge technology, this immunotherapy. We have, think about it. You didn't know Jimmy Carter, you may have forgot Jimmy Carter had cancer. He was on immunotherapy. Jimmy Carter's 94 years old. He was diagnosed with metastasis to the liver, to the brain, and he was on the immunotherapy. And now, what's coming down the pipeline? You have technologies that look like an antibody, but have the ability to snatch onto a killing cell and bring it close to the cancer cell. So it's almost visualizing like a bunch of bees attacking the cancer. These are the technologies that are coming down the pipeline, and we need you to participate. Because when you participate, it not only impacts your life, it impacts the people that are around you, your family, your loved ones, and future generations of your family and everyone. And so the reason why I want to highlight this participation, Dr. Tammy Denise, 16 years. They said she was supposed to die in 5 years. I had on one of our webcasts a gentleman, high-risk prostate cancer patient, diagnosed when he was 47. 27 years later, and 5 clinical trials, he's still kicking and still fighting. So that's why, even though I told you earlier about if you don't detect it early, your survival is shorter, or if it's metastasis, your survival is shorter. Don't lose hope, because these clinical trials that are out there. Another person I spoke with, he had metastasis, prostate cancer patient with metastasis all over. He was on that immunotherapy clinical trial. That was 9 years ago. Almost 10 years. So for him, he's at 100% survival. So don't forget the clinical trials. And this is what something else that we'd like to talk about too. At one time, clinicians were saying, well, the only thing we're trying to do is keep you alive. Like they told Reverend Tammy Denise, well, you got 5 years to live. So we're not gonna worry about anything else. Tammy Denise, 16 years survivor. So now you gotta talk about what else is important, how important your bone health is, because the bones are important because they support everything in your body. And if you fracture something, guess what happens? Your quality of life changes dramatically. So that's why it's important, along with your treatment plan, because you're going to live longer. You have to make sure your bone health, your bones are healthy. And that's by good nutrition, resistance exercises with your grandchildren or your loved one, plenty of sleep, and then like one of those PHEN survivors, playing golf, walking 18 holes and getting a hole in one. That's what you need to recognize. And that's what Carrie's touch, that's what PHEN, that's what we're all about. We want to help you along your cancer journey. And then lastly, what I mentioned earlier about different ways of communicating with people. We at PHEN and Carrie's Touch recognize that people learn differently. And we look for these novel ways of delivering our message, like the graphics that the people from Get the Picture help us design. But in addition to that, we have webcasts where you can speak with the doctor. We have educational programs where we'll Zoom in on Saturday and hold Zoom educational programs. We also have a national touring stage play, but this was prior to COVID. We toured all over the country to talk about and with our stage play called Daddy's Boys. And this stage play was about a Black man who had 3 sons, who just found out he was diagnosed with prostate cancer. Now, it's just not just a regular stage play, because since we have control of the script, we insert early screening, clinical trials, treatment options, bone health, genetics, genetic testing, PSA, when to start screening. All these things are weaved into the Daddy's Boys stage play, which was moved from a stage play to almost like a mini series now, because we had to go virtual because the message was important for people to hear. What we're seeing here is that we have to be creative. We're not afraid to jump out there. And even you do what you have to do to support your patients. So thank you, Linda, for allowing me to kind of share that message.
Thank you so much. So Dr. Keith, we have a couple of questions that have come in. I definitely want to acknowledge the dynamic duo that you and Reverend Tammy have been called, the educator and the evangelizer of the patient story and importance. Just amazing work.
But can I say something? You made a comment that was very interesting, because that is a role that PHEN uses. So when we disseminate information, we also have church partnerships that serve as ambassadors to educate people in their church. Sorry for interrupting, but I wanted to tie that in there too.
Which was a very nice tie. And definitely wanted to also kind of make a shout out from one of our participants who put in the chat. There is also the way that younger cancer patients are treated, right? Yep. And I feel like when I read that question and that comment, it actually made me realize that there's a lot that can be done educating our HCPs, the providers, right? They make judgments about who they're going to talk to about a trial, who they're going to offer certain treatment to. And Keith, certainly PHEN has done a lot of work in that area, reaching out directly to the physician community to say, hey, here are the guidelines. Hey, patient, here's what you should go in to your doctor with this very easy downloadable piece of paper to say, here are my questions. Here is what I want my life to look like. Certainly in its work that Carrie's touch and Tammy Denise, you do as well. So one question that I want to make sure that we definitely get answered, Carla asks, explain trial versus chemotherapy. Because I feel like there's like, I could type it into the chat, but I feel like, you know, the spoken answer to that from both perspectives would be so valuable. So do you guys both want to jump in and answer that?
Tammy, would you like to start?
Sure, I'll jump in. I was like you, Linda. I wanted to type in the chat, and I was like, no, there's scientists on this call. Let me let the scientists respond to that.
Talking about this is from the vision, from the eyes.
The eyes of the patient. Well, I would say that they're both treatment options, and being in a clinical trial, chemotherapy can be part of the treatment option that is your treatment plan that your oncologist would prescribe to you. On the other side of it, if it's just chemotherapy, then that is, you know, a treatment option in and of itself, but you won't necessarily get all of the perks that I'm going to call him Reverend Dr. Keith Crawford talked about with the specialization. I had 32 pages of possible side effects that I needed to consider when I was in my clinical trial. Well, what most patients would do would look at that. It's overwhelming. It's almost like terms and conditions when you get a new phone or get, you know, a new computer, and it's like, oh my God, I'm not going to read all this. Well, guess who read it all? I read all 32 pages. Oh, I'm sorry. It was 64 because it was 32 front and back. And I scheduled an appointment with the researcher, and we sat down for 4 hours and went over every possible side effect. And ultimately, they actually had to stop the clinical trial because African-American women were not faring so well with regard to the side effects in that trial. So that's a whole nother long story. We'll have to do a different session about that, but that's just the nugget in it. And my last statement around that I'm kind of going off of the question, but I want to say that when my oncologist came into my exam room and told me that he had a clinical trial that he wanted me to participate in, my first question was, well, how are Black women responding to this trial? And he said, I don't know. And I said, unacceptable. And that really is where Carrie's touch began. I didn't know it at that time, but I knew that if I wanted to live, I was going to need to advocate for my life as a Black woman. And that's what we teach Black women, brown women, yellow women, green women, purple women. We don't care what you look like. If you need us, we are here. Call on us.
So you've answered the question. And just to clarify it again, the audience member was looking at an individual treatment, and then in a clinical trial, you have an individual treatment. And what was very important was to distinguish between a non-clinical trial and a chemotherapy, and a clinical trial were using the same chemotherapy. But what was interesting is what Reverend Tammy Denise said, and that was you read the information, and then somebody sat down with you to made sure you understood the information. And there's another point I want to bring up too that's very important. Because there are not a lot of African-American women participating in clinical trials, there can be drugs that would have gone out on the market that would have been accepted, and no one would have known that it had a negative impact on African-American women. That's why we have to participate. Because that finding was so significant, because they would have marketed, if they had no African-American women, they would have marketed that drug.
Absolutely, doctor.
There wouldn't have been an alert.
That's what I told my doctor. I said, you know what? I said, I'm going to enter this trial because if there are no Black women in this trial, there will be one, and they will have some statistics on one.
Yeah.
So Tammy, let's dig in on that, because that was a question that came up in the chat. Okay. So given the history that unfortunately we are all very too painfully aware of, the mistrust, the lack of information, I mean, on and on and on. Like your statement right there was so powerful to me. You said, unacceptable to your doctor saying, it is not okay that there is no information you can tell me. But then you you pivoted. You took that moment and said, there's going to be me. Like, I am going to be the representative. I am going to do this for myself, but also, right, for my sisters, for, who come behind me. So like, help talk through kind of the why and the what. And when you talk to, women of color and say, here's my story, like, here's, something to consider. Like, yes, there's, history and the reality of what has happened. Like, talk to us about that, because I think that's really important.
Yeah, absolutely. And I'll say this, my oncologist, we remained in relationship because the objective wasn't to challenge the doctor or get the doctor told. The objective was to have him understand and hear me so that we could partner in making the best decisions about my health. Like I said to him, I said, I'm 39 years old. I'm a single mom. I've got kids. I want to see my babies grow up. I want to see their children. I want to go to their high school and college graduations. And he agreed and he partnered with me, and we became a phenomenal, powerful team, which, for me, it's God first. And then this amazing medical team that listened. And patients, I encourage patients who are not as forward as I am, who would never challenge a doctor, to understand that those are actually your patient rights, to have a conversation with a medical professional to where you understand what they are saying to you and they understand what you're saying to them. And so when I made that decision and I told him that I needed time, I didn't make the decision in the moment. I said, I need time. I got to go pray and process. And then I got my team together, my family, my inner circle. We talked about it. And I said, if I'm going to be dead in 5 years, I tell you what, if I'm going to be in this clinical trial, they are going to know information about at least one Black woman so that no doctor can ever go into a patient's room again and say, I don't know.
And it's important that everyone recognizes is that there are so many people looking in at the clinical trial. It is safe. You have committees. Everyone knows that you're participating in a clinical trial. You have more than one individual who's overseeing your care. So not only is it cutting edge technology, not only is it standard of care, meaning the care that anyone in the United States would receive, plus, but the quality of care. And some people would argue with me, but I think you have more quality care if you have more eyes looking in on you. And that's why I said, if you're going to get good care, if you're an African American, the best care you can get is in a clinical trial.
Dr. Keith, I agree with you wholeheartedly because I was super, super, super sick. I mean, like I said, it was 64 pages total. If I were to guesstimate, there weren't 64 different side effects that, just the literature to accompany it, but I got almost all of the side effects.
And it's important. See, what you're saying is there's the side effects and then there's the cost. Now
let me finish my thought, because I, as a patient, I didn't care about the cost. What I cared about was living and quality of life. So I got those side effects. But so my point about having the best care was because there was a full team assigned to me for this clinical trial. If I couldn't get in touch with my doctor right away, I could contact the researcher. And, she came to chemotherapy there was just this phenomenal amount of support that you don't get if you're not in a clinical trial.
Yeah.
And so I wanted to make that point, in support of what you were saying about having access to the best care available. I don't know that I would have survived chemotherapy hemorrhoids if I didn't have the access to the care that I had with that clinical trial team. Mm-hmm. Because chemotherapy hemorrhoids, I tell people, I never thought I was going to die, but chemotherapy hemorrhoids really made me beg God to take my life. I said, I can't do it anymore.
And so see, what people have to recognize is Reverend Tammy Denise has gone through this.
Yeah.
So she serves as a point of contact. Yeah, some people can say clinical trials are hard to get into. You have to apply. You have to participate. With our site, the Find Your Trial, the FIGHT tool. Our FIGHT tool allows you to, one, go to the section where you're diagnosed. Look at the list of clinical trials. From that list, there's the contact information, and you can look and see what city these clinical trials are hosted in. And what we're doing now is we're taking a step further. And what we're doing is going to be working with several clinical trial sites. So again, notice the title of this session. It's Through the Eyes. So what we have to do is educate the clinician through the eyes of the patient so they can better communicate. So we're trying to close the gap, improve cross-cultural communication, improve the communication between investigative site and the patient. And like we said, prostate cancer patients, PHEN, call us.
Right.
Because we'll help guide you. Same thing with Carrie's Touch. Call.
Absolutely. Amen. Dr. Keith. So in the last few minutes we have, we're going to do a lightning round. So this is going to be the moment. Amazing questions. We're going to make sure contact information, the visuals are available for sure. So please, participants, you can reach out to any of us for more conversation, for great information. We have two amazing resources here. Okay, lightning round. You can give me your top. I was going to limit you to 3, but I know you both too well. So your top five, anything that you want the participants to know walking out of this, and kind of thinking, Keith, to the way you described through the eyes of the patient, okay? Top 5 things that PHEN does for patients through the eyes of patients to represent patients. Tammy Denise, same for you. You have like the floor to share your top 5, whatever you would like to share with the audience.
Doctor, I started, you go.
Oh, you know, I always say ladies first.
I know.
Thank you. So when we're talking about our top 5, I start out with the fact that the most important thing is Prostate Health Education Network is your reliable source for prostate cancer information. That's 1. 2, early detection. Black men, you are at high risk. Black men, you are at high risk. And wives, sisters, daughters, grandmas, Black men are at high risk. And they need to start this discussion about prostate cancer and screening at age 40. So we need your help in keeping them in line, chief medical officers of the family. That's important. Early detection, the earlier you detect the disease, the longer your survival. PHEN path. PHEN path is extremely important now. There was a point where all of a sudden you just had, oh, well, you know, I got this diagnosis, but I don't know. Use our PHEN path educational tool so it can help you make that two-way conversation with your clinician, healthcare provider about your care. Participate in clinical trials. You have to participate in clinical trials because not only could it extend your life, but it can be of benefit to your immediate family, to all your relatives, and to all those men who follow. So, and I close. One of them, get tested at 40. Start the discussion at 40. I can't stress that more. And call us, contact us, reach out to us. Thank you.
All right, it's my turn. Our top 5, Carrie's Touch, teaching, outreach, understanding, caring, healing. We do that through advocacy, awareness and education, research, and support. Black women can and do survive breast cancer. That's number 1. Number 2, Dr. Keith said it perfectly. Early detection saves lives. I was young, I had aggressive tumors, but we caught it early. And so I had a caveat of treatment options available to me, such as a clinical trial. Not saying that you can't get in a clinical trial with late stage diagnosis, but at that time, there were just so many available for early stage diagnosis. So early detection does save lives. I know that there are reputable organizations out there that say get a mammogram starting at age 50 and get it every other year. Well, my experience for the past 16 years personally and with women around the world, many more Black women would be dead if we waited until age 50 to get our first mammogram and if we waited every other year. Go get your mammogram at age 40. Do your breast self-exams. Get your clinical breast exams. And here's a tip, because there's a lot of guys on here, and I like this part. So here's a tip. Get to know your partner's breast. Married folk, get to know your partner's breast. And if you feel anything that is abnormal, you should be the first person to make her or him aware. And I say that because men get breast cancer too. And as a reverend, I do say married people. Carrie's touch. We fight for those who will not, cannot, and do not know how to fight for themselves. Call us. Unfortunately, the toxic strength cape that turns into a blanket, we meet women with the cape on who can handle it. And actually, because Malcolm X said that Black women are the most disrespected, unprotected, and neglected people in the United States, we don't know how to accept help. We don't know how to accept someone else loving us, caring for us. So say yes to you and accept help. I'll stop just because I know we're at time.
Amazing. Well, it has been too fast an hour. Two of my truly most favorite folk. Dave, Lauren, Grit team, much love to you for holding this, doing this again and allowing us to partner. For me, it's important to have the voice of the community, the voice of people who have been building year upon year programs who are here to support patients. We hope to be here next year. We hope at some point in the future we can be live together, even if it's masked and gloved up, but resources. I just really want to reiterate the amazing resources and support both of these organizations provide. So thank you so much for being here with us. And Tammy, Keith,
Yes.
you know, I love you both. And thank you so much for spending time with us.
And we want to thank the audience also for just.
And thank you. Dr. Keith did the protocol. So thank you to everybody he's listed.